If you have health insurance, you depend on it to pay the bills. But a Five on Your Side investigation into a program for Ohio's public employees is raising serious questions for Northeast Ohio cardiac patients. On Your Side Chief Investigator Ron Regan joins us live tonight with what he's found.
Well, Danita, it's one of the largest health and retirement programs in the country. But some retirees say it's bargaining away health care.
No chest pain type things?
No chest pain. Get a little short of breath at times.
Every year, 166,000 retirees across Ohio depend on health insurance to pay medical bills. They're members of OPERS, Ohio's public employee retirement system. But last year, we found the program made big changes. In this letter, retirees are told we've negotiated new contracts with providers. Why? We found the Board of Trustees voted to save nearly $93 million over the next 3 years by simply switching medical providers.
Did you bargain away health care?
The reason why OPERS chose Humana is that Humana met both the needs of our members and the financial obligations of OPERS.
But Barbara Andrisco, who's a heart patient, says a health plan that's supposed to protect her is now causing stress. She was even billed for a stress test until she repeatedly complained. A test she says was routinely paid by the previous plan.
They never said we were never going to pay for it. They just kept delaying and delaying and delaying, and all the time I'm calling and I'm being more stressed out all the time.
The same thing's happening to 81-year-old Bill Hastings.
Several procedures we had, we thought were covered by insurance. But when we got the bill of expenses, it turned out that they weren't accepted.
Bill also has heart problems.
Yes, it is absolutely stressful.
And when a claim for his wife was denied, it wound up with a debt collector. Another heart patient described an emergency room claim that was also denied. And still another heart patient said she stopped seeing a doctor for fear she'll be stuck with the bill. And patients aren't the only ones complaining. Dr. Harry Prasad is a cardiologist.
I've never had problems to this degree with any insurance company, and I've been in practice 21 years.
Even vital tests are now being questioned.
One of them is a form of stress test we call nuclear stress testing, which we do right in our office. To do that, we have to get authorization, which we do. Very often we've had delay in payments of 3 to 5 months. It should take 1 month.
And while OPERS is standing by its decision to switch providers,
You can't really sit here, though, Julie, and say independently yourself that you believe service is as good as it was before.
I can't really speak to their business practices.
heart patients wonder if life-saving tests will be paid for.
Makes you very stressful. Makes you very stressed. As I said, I have to go and see him in February, and I'm hoping he doesn't say I have to have a stress test, because I'm now afraid they aren't going to want to pay it again.
Well, the state's retirement system says it's fighting to remain solvent and needs to save money. And it says it's not aware of increased complaints. Now, Humana is the new provider and sent us this letter saying it pays 91% of claims in 14 days or less. It declined an on-camera interview, saying it cannot discuss individual patient claims.
Well, Ron, this has to be a pretty serious concern for those people. You believe that your bill is going to be paid right away, so where can these people go if they have questions about
Yeah, they have a lot of questions. And if you have questions or you have complaints, you don't know where to turn, you can log on to newsnet5.com. We're going to show you some important links that can help you. And, of course, let me know if you've had problems. You can also see the extended interviews that appeared in our report.
All right. Thank you very much, Ron.